Without further ado, I'd like to present to you Fred Trankel, back fresh from a plane of Madrid, and he is here with us from the ship office to talk about Medicare Part D. We are so grateful to have you.
Thank you. Thank you, Chastity, and thank you, everybody, for uh, joining me today so I can talk about Medicare Part D. And just to give you a little bit of background about myself, I am a volunteer counselor with the program called SHIP, and we're all volunteers. We volunteer to help people with Medicare, and I've been doing this for a little bit more than 7 years, and there are currently 7 co-volunteers with me. And we each handle mostly calls in the ship office in Towson, and we talk to anywhere from 5 to 10 people during a 4-hour session every week. I've had a fair amount of experience with Part D. Last year, just before open enrollment started, our ship manager decided to resign, and so I kind of stepped in along with Shelby, the former manager, and we sort of ran the Part D sign up last year without a whole lot of preparation. So I've probably answered a lot of Part D questions. Um, and hopefully I can answer some of those for you, all of you today. What I'm going to do is, since I'm not actually in front of you, but will be sharing my screen, is I'm going to periodically stop and say, does anybody have any questions? And then we can continue. I'm going to present a lot of information. Some of it may just, it may just go, completely by you. But what I want to do is sort of give you an idea of the tools that you can use to pick your Part D plan, answer some common questions, and maybe help you pick your new Part D plan for 2026. So I'm going to share my screen here. Can everybody see that? Or anybody not see that is probably a better answer.
We can see it. Yep. Just
All right, so Medicare Part D, our goal is to help you find the best Part D plan for you. So our items that we're going to talk about today, first is how Medicare uh, implements drug coverage, how you enroll in a Part D plan, what are some of the common terms associated with Medicare Part D or Medicare Advantage for that matter, how you compute the total cost for the drug plan that you select, how you use something called the Drug Plan Finder, what are some factors that affect the cost of your drug plan, how can you get financial assistance? And what are some alternatives if Part D is not working well for you? So hopefully those are items that you all want to hear about. I'm certainly open to talking about anything else related to Part D if you want to ask it. So first of all, if you want to have drug coverage and you have Medicare or you're over 65, what options do you have? Well, if you have what we call original Medicare, that's Medicare where you get a Medicare summary notice from the government. You have Medicare Part A and B. Your only option is to get Medicare Part D. Another option that you might have is Medicare Advantage. I'm not going to go into Medicare Advantage a whole lot today, but Medicare Advantage is Medicare that is delivered through a private healthcare plan. It's kind of an alternative to original Medicare. All of the Medicare Advantage plans, well, the vast majority include drug coverage. If you're still working and you have, let's say, Medicare Part A, um, you probably get drug coverage through your employer insurance plan. And hopefully that coverage is comparable to what you would get, or maybe even better than what you get with Medicare. Some people do get drug coverage as retirees from certain companies. The number of companies offering this is really decreasing. It's mostly government entities that offer this now, but there are still a few companies that do as well. And then there are what we call other sources of drug coverage. VA, for example, includes drug coverage. So you could have Medicare Part A and B and get your drug coverage through VA. TRICARE, which is healthcare for military retirees, includes drug coverage. And if you're a federal employee, you may choose to get drug coverage through the federal employee retirement healthcare plan. Medicare really wants you to have drug coverage. In fact, if you don't have drug coverage, Medicare is going to penalize you. So you really don't have an alternative. If you don't want to pay the penalty, you need to sign up for the drug coverage. Some people ask me, I don't take any drugs now. Can't I just wait? Well, the way that Part D is designed, if you wait, you're going to be penalized even if you're not taking any drugs. So the penalty that you would have to pay if you defer getting Part D is you have to pay 1% of the average monthly premium cost for each month that you didn't have coverage. So, for example, if you waited for 2 years to enroll in a Part D plan, that's 24 months. That means that your monthly premium is going to be increased by 24% of whatever the monthly premium is. In the example here, it would be $9.60 extra every month you would pay if you deferred getting Part D for 2 years. Now, I've had people call me up and they're really proud of the fact that they are now in their mid 80s and they have not had to enroll in Medicare Part D or any prescription drug plan up to that point, but now they need to fill a prescription and they want to join Part D. And I have to be the bearer of bad tidings and tell them that they're going to have, maybe 20 years worth of penalties that are going to get tacked on to their monthly premium for the Part D plan. So I don't know how you can get the word out, but if you know anybody that's holding off getting Part D, the sooner they get it, the better. When can you sign up for a plan? Well, you can sign up for the plan when you turn 65 during what's called the initial enrollment period. That's the 3 months before your 65th birthday, the 3 months after your 65th birthday, and the month of your birthday. Yes, contrary to what some people believe, you're not required to sign up for Medicare 3 months before your 65th birthday. You have that 7 month period of 3 months before, 3 months after, in the month of your birthday. Now, if you're still working when you turn 65 and you want to continue working for a few more years, you would not take advantage of the initial enrollment period. But when you retire, you would get something called a special enrollment period. And with that special enrollment period, You have a number of months after your retirement starts, after your coverage from your employer ends, to get uh, the Part D plan, Part A and B if you want as well, without any penalty. Those are the two main ways to sign up for a drug plan. Additionally, there is an annual open enrollment period. That is from October 15th to December 7th every year. And that is a time that you can either change from one plan to another, or you can sign up for the first time if you missed it previously. Whatever plan you signed up for um, during that open enrollment period, it becomes effective um, January 1st of the new year. These are the only times you can sign up or change a plan unless you get some sort of financial assistance from Medicare. So I have people that might call me up and say, here's a good example. Somebody calls me up in February and says, I just found out that the drug plan that I paid only $17 a month for in 2024 now costs me $47 a month. So I want to get a new drug plan. And I have to tell them that you can only change drug plans during open enrollment periods. So you are stuck with that increased premium cost if your drug plan increases it. You're stuck with that until the next open enrollment period. Or, I have people that, for whatever reason, they sign up for Medicare A and B when they were first eligible, but never signed up for D and decide in, let's say, April, it's probably time that I got a drug plan. And again, I have to tell them that you only can sign up during open enrollment unless for some reason you get a special period. So I'm going to stop sharing at this point and ask whether anybody has any questions so far. Okay.
Uh, Veronica seems to have a question.
Yes.
Yeah. I understand the open enrollment is from October the 15th until December, but here's my question. My Medicare starts on my birthday on October the 2nd this year. Since it's my birth month, can I get Part D after my birthday? Do I have to wait to get Part D until open enrollment, or can I do it because it's my birthday month or
So
up to 3 months
that's a
after?
really yeah, that's a really good question. So yes, you can get it prior to your birthday. You have that 7 month initial enrollment period, during which time you would sign up for a 2025 Part D plan. You could also, after October 15th, sign up for a 2026 Part D plan. So sometimes I have a case where I'm counseling somebody and I sign them up for the current year because their birthday happens to fall in that period. And then, either I do it then or I do it later. I sign them up for a new plan that starts, in 2026. So you would be signing up for both.
Okay. Okay. So I can do both. All right.
Yep.
That's fine. That
Now,
answered my.
yeah, and let me just mention this. If you're in a plan and you like it, um, you don't have to make any changes during the open enrollment period, and the plan will automatically continue into the next year. But this is
Okay.
something to be careful about because these insurance companies are changing these plans all the time. So when open enrollment comes around, you should at least check and make sure that your plan is going to continue into the next year. And then if you want to continue with it, you don't have to do anything. If they've made changes to it that you don't like, that would be a time for you to make a change.
Okay. Thank you.
Okay. Did anybody else have a question? Okay. We'll go back to sharing. All right, so I'm going to go through some terms quickly. They may be familiar to you, but they're kind of important, so let me just mention them. The first term is premium. Premium is the monthly amount that you pay in order to belong to the plan. Now, if you've got any other kind of insurance, like auto insurance or homeowners insurance, you're very familiar with the premium. It has the same function with Medicare Part D and any other insurance plans. So it's similar to the premium you pay for auto insurance or homeowners insurance or life insurance. The premium amounts range from $0 to $120. Believe it or not, there is a plan this year, WellCare Value Script, that many people signed up for that has a $0 premium. That means you don't have to pay anything to belong to that plan. Now, a lot of people called me up, thought it was a scam because, how could you get something for nothing? But you see that the insurance companies in this particular area, Medicare prescription drug coverage, make most of their money from the co-payments and the payments that Medicare makes and not from your premium. So I can assure you that WellCare is not going broke simply because they have a zero premium for their plan. But it is a good reason for somebody, even if they don't take drugs, to sign up for a plan because in this case, it doesn't cost them anything. The second term is deductible. A deductible is the amount that you have to pay for your prescription drugs before the insurance coverage begins. Hopefully you're familiar with this term from other insurance. For example, if you have a deductible on your car insurance and you have an accident, you have to pay that deductible for the car repair before the insurance will kick in. Well, the same thing holds true when it comes to Medicare Part D. If you have to purchase some prescription drugs, you have a plan with a deductible, you have to pay for those plans from up to the deductible amount before the insurance actually kicks in. The standard deductible for most of the Part D plans is $590. That means that you are responsible for the first $590 of cost that you have to pay when you go to the pharmacy and pick up the prescription drugs. Now, there are some plans that have lower deductibles. There are plans that have zero deductibles. Generally, they have higher premiums. Now, the last point I have on this slide is really important. Generic drugs are not subject to deductibles. So if you take generic drugs, and generic drugs are basically drugs that are no longer on patent, that are being made inexpensively by certain pharmaceutical companies. But if you take a generic drug, the insurance kicks in immediately. So I take 3 generic drugs and I have paid nothing for them so far this year, even though my plan has a deductible of $590. So where you really experience the deductible is if you have some drugs that are more costly than generics. Copay amount. The copay amount is the portion of the drug cost that you must pay. So for example, if the drug is priced, the list price of the drug is $20 and the insurance company pays $18, your copay is $2. Now, An easy way to remember the copay, that's the amount that you pay when you go to the pharmacy. That's your copay. Or if you get your prescription drugs via mail order, it's what you pay for the mail order. Normally, as I just said, you have to meet your deductible before you have any copays. So the total cost of your Part D plan is going to consist of your monthly premium, your deductible, annual deductible, and your copay amounts. Monthly premium, what you pay for for the prescription drug plan each month. The deductible, usually $590, that you must meet before the insurance kicks in. And the copay amounts, what you pay when you go to the pharmacy to pick up your prescription drugs. Okay, so again, I'm going to stop for a minute and see if anybody has questions.
Hi. Last year, because I was formerly a state employee and I had my drug plan through my state in retirement, last year, because of changes that they made, the General Assembly allowed us $750 towards our premiums or our medical costs. Do you know if that's still in effect?
We have not heard anything about what the state's plans are for this year yet.
Okay.
Um, Last year, I think we heard around mid-September, and we did get a lot of state retirees talking with us. Uh,
Mm-hmm.
of course, the state hired a benefits company to manage that.
Yes.
But we have not yet heard that. The fact that you have not heard that yet either is a little daunting. But no, we haven't heard anything yet.
Okay, thank you.
Okay, let's continue. Okay, so here's an example of the total cost. So Mark signed up for a Part D plan with a monthly premium of $20. His plan has a $500 deductible. He takes only two drugs and he refills those every 3 months. For the first two refills, he pays his deductible. After the 6 months, he meets this and he has a $25 copay for each drug for the last two refills. That sounds like a lot of numbers I'm throwing out. Let's break that down. So his total cost, first of all, he has 12 months of premiums. His premium is $20 a month. So that's 12 times 20 or $240. Then he has to meet that $500 deductible. So he's paying for the full cost of the drug until he meets that. So that $500 factors in the cost. And then for the remainder of the year, he has a $25 copay for each drug. And so he has that $25 refill for two drugs, and he pays it uh, twice for the remainder of the year, which adds up to $100. So the total cost of the drug plan for him is $840. Okay. Here's another example. Nancy signed up for a Part D plan with a monthly premium of $12. The plan has a $590 deductible. She takes only two generic drugs and she refills those every 3 months. She has a $5 copay for each 3 month refill of the drugs. So what's her total cost going to be? She has 12 months of premiums. So that's 12 times 12 because the monthly premium is $12. That's $144. Because she only takes generic drugs, she never has to pay the deductible. And she has copays of $40. That's 4 refills a year, $5 copay per drug for each refill. So her total cost is $184. Hopefully you fall into one of those two categories so you can see how the total cost gets calculated. All right, let me stop just for a second. Everybody with me on the total cost. Now, sometimes people call up and they say, Fred, I want to get the best drug plan that's out there. What drug plan do you recommend? And I'm sure there are some plans that have higher quality ratings than others, but for the most part, we counsel people on how to pick the drug plan that has the best cost for them. Because all things being equal, that's what most people are interested in. And there can be a wide range in cost between one drug plan or another. And that's why the tools that we use and the advice that we give is focused on the lowest total cost. All right, so we use a tool called the Drug Plan Finder that Medicare provides. It's an online tool and you can access it by going to the Medicare.gov website. What information do you need for that? You provide the names of the drugs, the dosage, and the frequency of use, and the names of the pharmacies that you want to use. And that plan finder automatically computes the total cost for you. So that computation I just showed you, that's something that this plan finder tool actually does if you use it. So how do you use it? You go to Medicare.gov. It looks something like this when you go there. You select the option that says Find Health and Drug Plans, the one I've got circled there. You put in your zip code. You select the type of plan you want, which is going to be Medicare drug plan. And if you get any assistance in paying for your Medicare, you would select it from this screen that shows up. For example, if you have Medicaid, you have SSI, you have a Medicare savings plan, or you have extra help. Many people select those. Many select I don't get help from any of those programs. For what we're doing now, we're going to say I don't get help from any of those programs. So I'm going to show you an example using this plan finder for 3 drugs: amlodipine, a 10 milligram tablet, atorvastatin, a 40 milligram tablet, and oxycodone, a 20 milligram tablet. So let me stop sharing for a second there. Share. Somehow I've lost it. Okay. Okay, can everybody see that? This is the screen that you would see after you answer the questions I just showed you.
Yes.
Okay. So do you want to see your drug costs when you compare plans? You say yes. And then it gives you this screen. And you start to type the first drug. So the first one was amlodipine. And notice that as I type it, a series of suggestions show up. I click on the one I want. I go over here and I click on Add Drug. Gives me 10 milligram tablet. That's the dosage that I want. Quantity 30 every month. That basically means you want one a day. Now, many times people want to get their drugs in a 90-day quantity. So you can change this to be 90. You can change this so that it shows up to be every 3 months. And click Add to Drug List, and it's been added there. Then we go to pick another drug, orvastatin. Add that. Already forgotten what my dosage was, 40. Again, if I want to get, I'm taking one a day. If I want to get this in 3-month quantities, I change that to be 90 every 3 months. Click Add to Drug List. Now I've got these 2 drugs showing up. Last one, Oxy. Click Add Drug. I think it was 20 milligrams. So we click on this pull down here. With 20 milligram tablet. It was 60 a month. Now with oxycodone, it's kind of a codone, it's kind of a special drug. In many cases, they'll only let you order it in 1-month quantities. Just for this example, I'm going to do it in 3-month quantities, but if you happen to take this, just be aware that it might not work that way. All right, 20 milligram tablet, 2 a day, 3-month quantity. All right, now I have these 3 drugs in my list. I can add more if I have them. I talked to some people, they have 20 drugs. You end up adding a lot of drugs sometimes. But we're going to work with these 3, so for simplicity. So if we're done adding drugs, we click on the button that says Done Adding Drugs. Now it says select your pharmacies. Pharmacy makes a difference here. Now, I usually start by asking people what their pharmacy is. Maybe it's Walgreens, so you could select Walgreens. Notice how Walgreens appeared at the bottom. Maybe you also like to go to Giant. Maybe you go to CVS. So you can add, a number of these in here. You can actually add up to 5. What I suggest is that people add at least a few. We often add mail order just to see whether it's a lower price for mail order. And then one more is Walmart. So I've got my 5 pharmacies here. As I said, you don't have to add 5 pharmacies. I add 5 just to see if I can come up with one that's got a lower cost than the others. Now, one thing to be aware of. People tell me I use the CVS on York Road. And that's great. Every CVS in this area is going to charge you the same thing for a drug. So you don't have to worry about the address. Now, if you go to a CVS in Pennsylvania, that might be different than what you pay at a CVS in Maryland. All right, so I've got my pharmacy selected. I've already entered my drugs. Now I click on Continue to View Plans. I click on that. It gives me a list of plans, And it gives them based on the lowest drug plus the premium cost. So the lowest cost plan for this person shows up first. It's Humana Value RX. It shows the monthly premium here. It shows what you will pay for the drugs plus the premium cost. And this is important for the rest of 2025, because we're still signing people up who are new to Medicare for drug plans for 2025. When we start doing this during open enrollment for 2026, it will show the total cost for all of 2026. But right now, this cost is just for the remainder of 2025. So $123 for the months of October, November, and December, which consists of the premium plus the cost of the drugs, the copays. So this Humana value plan is the lowest cost plan. The next lowest cost plan is this Cigna plan. It's a little more expensive, $123, $127. Continue to scroll down. Here is the WellCare value script plan. It's the third lowest cost. Now, here's something to look at. Notice that it ranked this third because of the cost for the retail pharmacy. But if you actually got the drugs through mail order, it might be lower than the other two plans we looked at previously. Then WellCare Classic Plan, and I can continue scrolling down. You might see your plan listed in here. It's going to continue to list them from the lowest cost all the way down to the highest cost. Again, these numbers are not, really that high because we're close to the end of the year. And you can even go into the next page and see some drugs there. If you want to compare two plans together, I'm going back to the top here. I can take this WellCare plan, and I click on Add to Compare. I can put the next plan in, Add to Compare, and the next plan in. And then I can click on this Compare. It gives me a side-by-side comparison of the plans. That just makes it easier if you want to look at them side by side. So let's say that you like this Humana plan, but you want to understand a little bit more about it. This area here called Plan Details is something that you would click on to find out more about it. If you really could care less about how the cost was arrived at, you could simply click on Enroll here, and you could enroll in the plan straight away without having to do anything else. But we usually like to look at the details so we can help you figure out why one plan might be cheaper than another. So let's click on this and see what comes up. So it has some further information about the plan. Of course, we know the premium's $24.70. Then it says retail pharmacy costs. This is the copay. I don't know why it doesn't say copay, but this is the copay. So if you go to a retail pharmacy, you're going to pay $49.77 for your drugs for the remainder of the year. And if you ordered the drugs through mail order, you would pay $51.69 for the remainder of the year. Let's continue to scroll down. It tells us what the total monthly premium is, the drug deductible, the address of the plan. Then it repeats what we entered in as the list of drugs we use. the list of pharmacies. Now notice that 3 of these pharmacies show up as in-network and 2 of them show up as preferred. I'm going to explain what that means in just a minute. So it shows the pharmacies we've picked. Now then this screen is really valuable. It shows you the cost by drug at each of the pharmacies. So this is what your copay is going to be at one of these particular pharmacies. So this amlodipine, which is a generic drug, you pay $2.73 for it at Giant. And this is for the remainder of the year. You pay $3 for it at CVS, $3 for it at Walgreens, but you don't have to pay anything for it at Walmart. And you don't have to pay anything for it if you go mail order. So notice that these 2 have the word preferred next to them. So that might be a big hint that the price that you pay at the pharmacy, the copay, is going to be lower if that particular pharmacy is preferred by the plan. Let's go down and look at this oxycodone. So at Giant, for the remainder of the year, you pay $44 for it, $57 at CVS, $58 at Walgreens, $54 at Walmart. Now that's interesting. Walmart is preferred, Giant is not, but in the case of this oxycodone, it actually costs less. So the preferred thing works sometimes, but doesn't work all the time. That's why it's useful to come in here and look at these details. There's something called the Medicare Prescription Payment Plan that I'll talk about briefly in a minute. This breaks down the cost by pharmacy for you, so you can see what the premium cost and the copay is going to be for each pharmacy. And then your total monthly costs. And remember, we said we're only going to get 3-month quantities. So since this would become effective in October, there's only 3 months left in the year. So this is really the amount for buying 1 3-month quantity of drugs. Scrolling further down, you can actually get in and see what the individual drug costs are for each refill. And I'll get to that in just a minute. But I've put a lot of information in front of you, so I'm going to stop and see if anybody has questions.
Are the drug companies allowed to change the cost mid-year?
Yes, they are.
Okay. They did that to me, so that's why I asked.
Yep. I think they're limited as to how much they can change it, but I'll go through one way they can change it without changing the price in just a minute. Everybody sort of see how that drug plan finder works? Okay, now we're going to get into the nitty-gritty here. So I'm going to go back to my slideshow. Before I get to that, let me just talk briefly about 2 financial assistance programs that are available to help with paying for Part D or help to pay for the drug portion of your Medicare Advantage plan. Extra Help is the name of one of the programs. If you are qualified for that program and it's based on income and assets, your income has to be below a certain level, or your assets have to be below a certain level. If you qualify for it, it will pay some or all of the plan premium. It eliminates the deductible. It means you have a $0 deductible. It lowers the copay for all of the drugs covered by the plan. It allows you to change from one plan, Part D plan, to another each month if you need to. You don't have to wait for open enrollment. And if you have Medicare Advantage, it allows you to switch back to original Medicare. You can apply online at the Social Security website or call Social Security, or you can call us. The name of the program is Extra Help. That's somewhat confusing. I could tell you there are a lot of times I'm talking to somebody on the phone. I'll say, I'll ask them, I'll say, do you have extra help? And they'll say, yeah, my son and daughter help me with my Medicare. And I say, no, I'm talking about the program called Extra Help. So it's a strange name for a program, but that's what the name of it is. And it helps people pay, um, with lower incomes, it helps them pay for a drug plan. The income limits uh, for uh, for an individual, it's 23,712 a year in income for an individual, 31,968 for a married couple living together. Assets cannot be greater than 17,600 for individuals and 35,130 for married couples. If you think you qualify for this and you have some questions, you can certainly contact us and we'd be happy to talk with you more about this. Another program that's available is the Maryland Senior Prescription Drug Assistance Program. It's called SPDAP or SPDAP. This is a program that will pay up to $75 a month toward the cost of a Part D or the drug portion of the Medicare Advantage plan. So these plans with like low deductibles, they're pretty expensive. And so a program like this that helps to pay for that premium can really assist some people. In addition, um, somebody who belongs to this program can change their drug plan once per calendar year without having to wait for open enrollment. So, if something happens and you get prescribed a very expensive drug, um, and your plan doesn't cover it well, and you had this Maryland SPDAP, you would be able to change to a plan that covers it better. If you didn't have this, you couldn't change until open enrollment. Income requirements are, pretty relatively high. An individual who makes 46,950 a year or lower can qualify, or a couple that has 63,450 joint income would qualify. And they don't look at your assets at all. So you could have $1 million in assets, and as long as your income is within these levels, you'd qualify for it. We have a lot of people that sign up for this. So if you had this Maryland SPDAP, um, if here's an example, Dave signed up for a Part D plan with a premium of $47. He has SPDAP that pays up to $75. His plan has a $590 deductible. He takes 5 drugs. Which are all generic. His co-pays on 3 of them are 0. For the other 2, he pays $20 for a 3-month supply. Well, what's his total cost? Well, it's because his premium is $47 and SPDAP pays up to $75. He doesn't have to pay any premium then. The state is going to pay his premium. All his drugs are generic, so he has no deductible to pay. And for his copays for For 4 quarterly refills, he has $160 in copays. So his annual cost is $160. So those are financial assistance programs. Let me stop again quick and see if anybody has a question on those.
You go to Medicare.gov to sign up for them?
For extra help, you would go to the Social Security website. For the Maryland SPDAP,
Mm-hmm.
I've got their phone number in the notes that went with this program. It's on the last page. You
Okay,
could
thank you.
also go to marylandspdap.com,
Thank you.
or you could call us. We have a lot of people that call up about that. Now, we have been told that state retirees getting benefits through the state may not be eligible for that, so that might be something to ask. Okay, now we're going to dig deeper into the Medicare costs. So here's my snow shovel here. Okay, so I told you that you can find some information in the plan details. And one of the things that you can find is the out-of-pocket cost, what you pay at the pharmacy for that particular plan when you click on the plan details. You can find out whether the pharmacy is in-network or preferred. Generally, preferred would be better. You can find the total cost for your drugs by pharmacy. You can find out something called the tier of the drug, which I will get to in just a moment. And you can find out the cost of the drug when you're in various coverage phases. So I'm going to skip through this just a minute. And here are the factors that affect drug costs. Got that hidden, so. The first one, probably the most important one, is called the formulary. The second one is called drug tiers. The third is the coverage phase. And the fourth is the pharmacy that you use. So we're going to look at each one of these. So first of all, what is a formulary? Formulary is the list of drugs that are covered by the insurance plan. So you may have a situation where a drug that your doctor prescribes for you is not on the formulary, and that means that that particular drug plan doesn't cover that drug. And if you need to purchase the drug, you're going to have to pay list price for that particular with that particular plan. A drug can be on the formulary for one Part D plan and not another. Some drugs that are prescribed by doctors are not covered by Medicare at all. As I said, if you have to take a drug that's not on the plan's formulary, you'll pay list price for the drug. The insurance won't pay anything. So this formulary thing is kind of important. Where can you find the formulary? Well, you can, some of the plans send out a copy of the formulary with all the literature that they send out during the course of the year. You can also call the drug plan and ask them whether the drug is on the formulary, or you can go to the drug plan's website. When we looked at the details for the drug, it did not show this, but if you had a drug in that plan finder that you entered in the plan finder and it was not covered, it would show up like this. It would have the like a yellow balloon here that says not covered. Not covered drugs can be very expensive, sometimes as much as thousands of dollars a year. Now, dosages and things like that can make a difference. Little known fact, a 10 milligram capsule may cost more than a 10 milligram tablet. So, and this is something that you can only find out by looking at the formulary, but I use this example when I'm teaching new counselors because we start by having them put a list of drugs into the plan finder and we have them put a 10 milligram capsule in instead of a 10 milligram tablet. And the drug plan ends up costing the person hundreds of dollars more a year. I don't know why, but that's what happens. Some dosages of a drug may be on the formulary and others may not. So your doctor may assign you a 10 milligram tablet, and that's not on the formulary, but a 20 milligram tablet may be. So sometimes it's simply a matter of taking a different dosage than what the doctor initially prescribed. Because of the way the drugs are manufactured, some dosages may be cheaper. For example, a 100 milligram dose may be cheaper than 250 milligram doses. I mean, this stuff is enough to give you a headache, believe me. Um, why does it work that way? Well, think about how this whole generic drug thing has grown up. Most of the generic drugs are manufactured in India or China. They're shipped to the US, they're shipped in certain dosages, and if you happen to need a dosage that's not shipped directly, then the pharmaceutical company may need to send it to a compounding manufacturer who basically has to break that 100 milligram dose into 50 milligram doses. As I said, you can find the formulary by calling the drug plan, by looking for it online, or there's this website called Q1Medicare.com. It's really helpful. So if you're handy and using the internet, you might, want to try looking at this. If anybody wants to see me demonstrate it, I will do that after the presentation. I'll be happy to show it. All right, the second thing I mentioned in terms of contributing to drug costs is the tier. So with Medicare Part D, drugs fall into tiers of 1 through 5. Basically, the lower the tier number for your drug, the lower the cost. So tier 1, preferred generic, is the least expensive. Generally, tier 5, specialty drug, is the most expensive. How do you find out what tier the drugs are? Well, you can find it in the formulary listing, or you can find it out on that Medicare.gov Plan Finder. Drug tier makes a big difference in cost. So the out-of-pocket cost is greatest for the highest tiers. The copays for generic drugs, tiers 1 and 2, are not subject to the deductible. And this is important. The tiers are set by the plan. So a drug may be tier 1 in one plan and a tier 3 in another plan. The result can be a wide variation in cost from one plan to another for the exact same drug. The plan finder figures all this in the background. That's why if you use the plan finder or if you work with us, when we use the plan finder, it's factoring all of this in. But if you're curious and you want to understand why one plan may be so much cheaper than another, has a lot to do with the tier of the drug or whether it's in the formulary or not. It also depends on what phase of Part D you are in. So there was a big change in Part D last year. Formerly, you had to deal with something called the donut hole. That was if you got beyond the initial coverage phase and you had to pay extra for certain drugs when you were in this donut hole phase until you paid a certain amount and then you went into catastrophic. Well, thankfully for all of us, the donut hole doesn't exist anymore. And now we only have three phases. The deductible phase, that's where you pay the full cost for the drug until you meet the deductible. The initial coverage phase, where you pay a portion of the cost for the drug and the insurance company and Medicare pay a portion. And then the catastrophic phase, where you pay nothing for the covered drugs. All the plans have a $2,000 out-of-pocket limit for covered drugs. Once you reach the out-of-pocket limit, there are no copays for those drugs. Now, that $2,000 limit includes payments that are paid by Medicare and the insurance company as well as by you. So you may not think you've reached the $2,000 limit, and you actually have. Most of the plans have a $590 deductible. That means you're going to have to reach that before you get into the initial coverage phase. But a few plans have $0 deductibles, and that means that you immediately go into that initial coverage phase. And if the drug is not in the formulary, it's not affected by the deductibles or the out-of-pocket limit. You're paying full price for the entire year. So again, let me just backtrack a second here. So here are the three phases again. The deductible phase, where you pay the full cost. The initial coverage phase, where the cost is shared between you, Medicare, and the insurance company. And the catastrophic phase, where you've reached $2,000 out-of-pocket limit and you don't have to pay anything. And this just shows the phases in a chart. The deductible phase, initial coverage phase, catastrophic phase. That $2,000 limit is based on your deductible, your copays, the payments made by the drug plan after you've reached the deductible, and the payments made by Medicare to the plans and the pharmaceutical companies. The only way I know of to find out your progress against this is your drug plan sends you either by email or regular mail a report every month, and it's maybe on like the third page of that. It shows how much you've paid toward the $2,000 limit. I mentioned this Medicare prescription payment plan. I don't think too many people signed up for this plan, but it's out there. It's like budget billing for Medicare Part D. You would use this if you're going to hit the deductible early in the year and you're paying, a lot of out of pocket for drugs. What it basically does is it tries to spread the amount you pay for the drugs throughout the year rather than giving you a big hit in the first few months of the calendar year. And the drug companies are supposed to notify you that this is available and allow you to sign up for it. And the last item we talked about is the pharmacy. Each Part D plan has agreements with pharmacies, and they're classified as preferred, in-network, or out-of-network. And this is another thing that the Drug Plan Finder takes into account. It can be hundreds of dollars of difference in the cost of a drug at the preferred pharmacy compared to the out-of-network pharmacy. Now, sometimes it pays to know who's got agreements with who. Here's my favorite example. Everybody is familiar with CVS. CVS happens to own a insurance company called Aetna, which has a Part D plan called SilverScript. So if you happen to have the SilverScript Part D plan, which pharmacy do you think is going to be preferred? CVS. So these arrangements are out there and it pays to pay attention to them. So here's an example with WellCare Value Script. Walgreens, Giant, and CVS are preferred. Walgreen is not preferred, it's in-network. In-network is a lower level than preferred. The total cost for these drugs at Walgreens is $82.38 for the entire year. The total cost at Walmart is $456.92. That's why when people tell me I only want to get my drugs at Walmart, I say, well, let's look and see what the lowest cost plan is before we say it's just Walmart. I am going to go back to my, can everybody see my plan finder here? No? Okay. Let me stop sharing. Look at this. Okay, remember our Humana, and we found this is the details, what we see for the details. And here you can see it tells you whether it's in-network or preferred. And you can see the pricing for the various drugs and the total cost. Now, suppose you want to see this tier thing I'm talking about. So I'm just going to pick an example of Giant. So it's down at the bottom here where it says estimated drug costs. I click on this plus sign. And first of all, it tells me what the retail cost of this drug is at Giant, what the cost is before the deductible, that's the first phase, the deductible phase, the initial coverage phase, and then the cost after the out-of-pocket limit of $2,000 is reached. If I go further down here where it says view more drug coverage, it tells you what the price would be for each of the 5 tiers with this WellCare. Is this WellCare? Which plan am I in? Humana. Tells you what each of the 5 tiers are, cost will be for this Humana plan. Then drug by drug, it tells you which tier it is. Tier 1, Tier 1, Tier 3. If it shows up as Tier 3, then it's going to be more expensive. Okay, I'll stop for some questions before I sort of summarize. Anybody have any questions? Have I completely befuddled you? Somebody always comes up to me after this and says, how could they make our healthcare system so complicated? And they're right.
I do have one little question. You sent out a PDF file with, but I thought I read something about the pocket for 2026 being $2,100 rather than 2,000. Did I read it incorrectly?
Yeah, I've just got 2025 information on here now.
Okay, thank you.
Also, for the folks at Seven Oaks, you've now heard this PDF document twice. What I did is if you registered through Opal, I sent it out. I will send it to Karen McDonough and Liz and Tracy. I'll do that right now. So maybe after this presentation, you can go see them or ask them to forward it to you in your inbox.
Okay. All right. So there may be some additional items involved for some of the drugs. They require prior authorization. That means that the doctor may write you a prescription. You go to the pharmacy, and the pharmacist says, I'm sorry, but I've found out that you need prior authorization for this drug. That means that the doctor has to provide proof to the plan that the drug is medically necessary for you. So this would be something you'd need to talk to your doctor about. The second thing is step therapy. That may be a case where the drug plan requires you to try a less expensive drug before they'll let you fill a prescription for this particular drug. Again, something that you need to work with your doctor on. And finally, quantity limits, which is the one I see most often. And I've seen it particularly with something like oxycodone, where there, have been some people, you're familiar with with all of that from years ago, and now they've set some quantity limits on it to keep people from becoming addicted to it. There are times when you have to look elsewhere for prescription drugs because maybe none of the Medicare Part D plans cover a drug. Here are some examples. GoodRx, Mark Cuban Cost Plus, or Single Care. These are all plans, or these are all programs that may offer you prescription drugs at a reduced cost. They do not work with Medicare Part D. So if you use them, the cost of the drugs through those programs are not part of your deductible, and they won't count toward the out-of-pocket limit. But for some people, you can save hundreds of dollars. I look at GoodRx every time somebody calls me who has a really expensive drug under Part D. Sometimes it's cheaper under GoodRx, and they decide to purchase it that way. Sometimes it's not. How does GoodRx work? You can go to their website, you can install their app on your phone, or you can call them. And any one of those three methods, you tell them the drug that has been prescribed for you, and they'll tell you where you can get it and what the cost would be. There's also something called assistance program. Many of the pharmaceutical manufacturers do offer financial assistance for purchase of their drugs. There are a couple sites that aggregate the list of those so that you can look for your particular drug and see whether um, the pharmaceutical company offers assistance for it. One of those is needymeds.org. The other is Partnership for Prescription Assistance. You can also go to the website of the company that manufactures the drug. And there are programs out there that do provide assistance. Again, sometimes they may fit your needs, and sometimes they won't cover people on Medicare or people that make over a certain income. There are also some foundations that provide assistance. PAN Foundation is one that we refer people to from time to time, and HealthWell is another. So here are some frequently asked questions. Should I reevaluate my Part D plan each fall during open enrollment? And my answer is absolutely. Either reevaluate it on your own or make an appointment with SHIP to review it every fall, or you could call up 1-800-Medicare. The reason is because I've seen this happen. Insurance companies may eliminate your plan and merge it with a higher cost plan. SilverScript did that last year. They may remove one or more of your prescription drugs from their formulary and no longer cover it. They may change the deductible. In some cases, Medicare has even removed a company from their list of approved plans. We had a company, trying to think of the name of it. Anyway, Medicare removed them from Part D. They violated some policy. The company sent out a mailing. Their mailing said, we're no longer part of Medicare Part D. Many people ignored the mailing, threw it in the trash. January came around. They didn't get a bill for a Part D plan. They call us up and we discover, lo and behold, they no longer have Part D because their plan got eliminated by Medicare and they didn't pick a different plan. So it really pays to check, your Part D plan during open enrollment. What can I do if I unexpectedly have to take a higher cost drug? This is the $64,000 question. This is a question I ask myself. This is a question friends ask me. This is a question you probably ask. You're rolling along fine. You got a plan like I do where you pay practically nothing out of pocket. You pay nothing for a premium and you go to the doctor and they discover that you have cancer or you have to have expensive surgery that requires some drugs with it. And all of a sudden, you find out that your plan doesn't cover those drugs very well. Well, the problem is you're not able to change it until open enrollment. If you have the financial assistance programs, extra help, or SBDAP, you would be able to change it. You could try and petition your plan to cover the new drug that you have. You could enroll in a pharmaceutical assistance program. You could look to another source for the drug. But the bottom line is, if you're stuck with the plan, you're probably stuck with it for that remainder of that calendar year. You can try and game the system by enrolling in a plan, a zero deductible plan. I'm going to tell you that cost-wise, it probably doesn't pay because you'll be paying $90 a month for generic drug, a plan that requires you'll be paying $90 a month. And if you only take generic drugs, you're overpaying for a plan that covers them. So you take the risk, which is what I'm doing. And it's not a good thing, but it's there. I've seen it happen to people. I've seen life event. We all know those happen to us over 65. There's not a whole lot of protection within Part D for you, that happening to you. Again, the main factors affecting the cost of the drug, the tier of the drug, tiers 1 through 5, 1 is lowest, 5 is highest. The dosage, remember, one dose may cost less than another dose, even if it's a larger dose. The pharmacy, there may be a huge difference in cost between preferred pharmacies and others. And the cost of the drug by plans. And that's sort of related to whether the drug is in the formulary or not. For more information, here are our numbers. I guess I did not put the SBDAP website there. I can look that number up if anybody's interested in it. If you need help through SHIP, call us at 410-887-2059 or send us an email at medicareinformation@baltimorecountymd.gov. If you want my Baltimore County email address, my email ID is ftrenkel. That's F as in Fred, T as in Tom, R as in Robert, E as in Edward, N as in Nancy, K as in Kite, L as in Lucy, E as in Edward, at BaltimoreCountyMD.gov. That is my presentation.
I'll drop that email in the chat, Fred, okay?
Okay, yeah, I should have put that on there.
Don't worry about it.
Okay, so any final questions from anybody?
Not a question, but if you'll provide the MDAP, I think SPDAP information, I'd appreciate that.
Elizabeth, if you could just drop me an email, I'll email it back to you.
Okay. Just so you know, a couple of years ago, um, the EpiPens were unavailable through regular drug companies, and I had to pay $1,000 for EpiPens through a company in Virginia.
Yep.
So, you know, these things happen.
Oh, yeah. We have a number of people with asthma that use something called albuterol. And in 2025, most of the drug plans dropped it in favor of some different drug. I think there's only one plan that covered it. People formerly they were paying very little for it. Now, in order to use it, they had to pay, a much higher amount.
Mm-hmm. Me.
Yep.
So Fred, if you've obviously given us a lot of information. If we are just information fatigued and really can't hold, what would be your number one takeaway for this presentation? And two, um, can we just also just put up the ship number one more time? Because I think if anything from today, we've learned that we have companions in this very complicated system.
Yep. So, my one suggestion, if you feel comfortable using the internet, try the drug plan finder on Medicare.gov, because all of the things that I showed you are covered through that. And you don't even have to actually enroll in a plan. You can just try putting some drugs in and see what happens and sort of play around with it. If you're not comfortable with the computer, feel free to call us. We are going to be everywhere during Part D enrollment. We have limited the senior centers that we're going to, but we're going to be in different regions for a number of days at a time. We'll also have people on the phone. And again, you all are going to be lucky. You'll have my email address. So if you email me and need help with Part D selection, I'll be sure to give you a call.
Excellent. And Opal's here to help too, because we've recorded this. So if you need to refer back to it, you certainly will be able to in the next couple days when we takes a little bit to upload it to our Baltimore County Department of Aging YouTube channel. So you can go to YouTube and check it out there. For the folks in Seven Oaks, please know I already emailed Karen, Liz, and Tracy. So if you want to stop by their office today, they might be busy. They might say I have to email it to you, but they should have it in their inbox. So thank you again.
I'll put that number up again quickly. Baltimore County SHIP at the top, 410-887-2059.
Great. Thank you so very much for being here. And Fred, thank you for your time, especially coming back from your vacation. We're glad you're here and was still able to join us.
Well, I was happy to do that. I hope I was able to help you guys.
Thank you. Have a good day, everyone.
Bye, everybody.